Hi, my name is Jareen Bautista and I'm back again at CSA. I have known Dr. Contessa for a while. She's a family friend and I've seen her do her craft, I've seen her do her work, and I know that with Dr. Contessa, I'm always in good hands. So the non-surgical nose enhancement is not permanent. I've had my last one 2 years ago and now I'm back for a booster. I'm really looking forward. Don't forget to click the subscribe button and the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's all welcome Ma'am Jareen Bautista.
Hello everyone. I'm so happy to be back.
So, we had a procedure in the past for Jareen, like we did some skin boosters, meso boosters there, and we also did some nose enhancement and also some under eye. Right? So today we're due for what we call hyco booster. Okay. So in the past we've been mentioning that we do a repeat treatment for this non-surgical nose enhancement because we are using materials that are absorbable, but of course they give this connective tissue build up. So we can already do like a layering of what we have done in the past. Like I think this is the third. Right? So the first one was 3 years ago, and then the second one was 2 years ago. So how was it, Jareen? Like up to now, do you still see the effect of what we've done for those 2 sessions?
Yeah, so they would actually say it's gone in 6 months to a year, but I still see the effects on my nose. I still see it shaping my face. It's not the same, but I see it slowly integrating into my features.
There you go. Because, you know, even if like our product materials, they are absorbed or hydrolyzed, okay, but they have done something inside. So it's like, it's working inside, but you see the effect on the outside. Because I was looking at the nose profile of Jareen, it's not the same as before. Before we have done any non-surgical nose enhancement. The first one, we only did the bridge part. The second one, we did the combination bridge and the tip columella. So for now, this is already a repeat treatment, okay? Some doctors are asking me, when you do your repeat treatment, how are you able to overcome tissue resistance? So I could share that today for our audience, for our doctors who are following us. We will show the proper technique when CSA Medical Aesthetics returns. And we are back. So we're doing the hyco booster treatment for Jareen here. So in the past, we did a combination of our hyaluronic filler and the PDO threads. Okay, for now, we'll just be using purely our PDO threads. Okay, so if you look at the nose area, we're checking on the so-called frontonasal angle. So actually, there's still a good height, but we wanna kind of increase the height, the radix height here, and still follow the 130-degree angle for the frontonasal area, okay? And then the nasolabial angle here, we want it like 95 to 105 degrees, okay? So it's kind of like within the 90 degrees here, and we still want to reduce the roundedness, okay, Jareen? Our nose tip is really round. We are Asian, so this is our, this is the Filipino feature of the nose. It's really round on the nose tip, okay? So we wanted to achieve like a narrower and an improved radix or dorsum height plus a very good columella appearance here and somehow still narrow the alar width, okay? So as with any of our procedures, we have to cleanse the area. We apply the topical numbing cream, okay? And then when doctors are doing the non-surgical nose enhancement, again, we do follow some measurements there or ratios and proportions. And when I check the the ulnar width. I also look at the so-called intercanthal width there. So far so good. Okay, just a minimal narrowing there. Okay, Joreen? So for our procedure today, since it's a repeat treatment already, as usual, we start with numbing the entry point with our lidocaine injectable. I pinch the tip of the nose, just pinching, okay? So I usually pinch hard, okay, so that you won't feel the entry of the needle here at the tip, okay? And then push a bit of our solution there, just a tiny prick there. So until you have the so-called the blanching of the skin, and then we can already stop with our injection. So what I do now, if it's a repeat treatment, I do have a so-called tumescent solution anesthesia, and I would want to do a so-called kind of hydrodissection, okay? So when you already have a repeat, expect tissue resistance because we have built up of fibrous tissues inside, okay? So it's kind of like a fibrosis there, a tissue fibrosis there. So it's like an application, or like when you're doing your subcision with your acne scars, at the bottom part, you kind of do a separation of those like fibrotic tissues there, okay? So I'll make an entry point now. So I follow the center of the philtrum there, okay, or center of the cupid's bow on the upper lip, and make my entry point, okay? So kind of like a semi-infratip there. And then I have this 1 ml of my tumescent solution, and also with the gauge 22 cannula, okay? So my tumescent, it's a combination of your lidocaine, and I also have NSS here, and you can also add your sodium bicarb to alkalinize your acidic lidocaine. So this is our entry point, and I just glide my gauge 22 cannula. So I pull up the nose structure here like this to create the space. So you tunnel in this cannula, okay? So we really know there's already like a build up of tissues inside, so fibrous tissues there. So at the first area where I have already my cannula tip there, I can already push a bit of my solution here, okay? So just to create a space inside, okay, separate it, okay? So some doctors are also asking me, do you combine your lidocaine with epinephrine? Well, if I do a procedure like it's just thread insertion only, I can use lido with epinephrine. But if I do combine it with my hyaluronic dermal filler, I just use my plain lidocaine, okay? Because whenever we inject hyaluronic, we are checking on the skin color, like if there is like blanching or discoloration. So we are looking for some signs of like, of course we know there are hyaluronic injections with some risks of complications. So we are watching for some signs there. As physicians, we do understand those, okay? So now I can use my PDO thread. Now, I have a gauge 21 cannula whereby it has a PDO thread inserted inside, okay? So it's a cannula loaded with a PDO thread, okay? So I'll use this gauge 21 cannula. So just insert at the entry point and glide it in the space that we have created at first. So if there is a resistance, you can do like a twisting of your cannula just to overcome the resistance there, okay? So this time I'm using a longer type of a cannula because before I've used like a 50 millimeter only for Joreen. Right now I can stretch the dorsum, okay, this one here. So I'll pull out. So make sure you pinch the radix so that the thread will stay inside, okay? So for now, I'll be using on the bridge 6 threads for Joreen because the previous ones we were only using like 5 of those PDO threads, but those were combined with our hyaluronic material, okay? So if there's a resistance, you can do some twitching there just to overcome the tissue fibrosis there. So right now, because I have a space inside created by that initial procedure that I did, whereby I injected like 0.7 ml of my tumescent solution. Okay, so there you go, just to create that space there. So it's better right now, so there's a good glide of my cannula inside. Okay, there you go, and then pinch here and pull out. Okay, so I'll be using only like 6 of these PDO threads on the bridge or dorsum part. Again, the anatomical layer is what we call layer 4. So layer 4 is like a deep fat layer, okay, above the bone and cartilage. Now I'll be working on the columella. Okay, so for some cases I use the same entry point, but if I have a short columella, like Filipinos, we Filipinos have this short columella. Okay, so I can use a second entry point and also find out what is the length of your thread, PDO thread that you use for your columella. Make sure that if you have a short columella, you also have a short PDO thread for this part here. Okay, I'm pinching again, so I can make a second entry point for during here. Okay, so if it's a long columella, I'll use the same entry point. Okay, so a while ago, I used my tumescent solution in the bridge. I'll also use it in the columella space here. So we have the so-called intercrural space. So pinching that and push the lidocaine solution here up to the anterior nasal spine. Okay, have to reach that area there, and it's normal that urine will feel a numbness on the upper lip, upper gum. It's like having a dental urine. Okay, so I'll just inject my lidocaine solution in this part here up to the so-called anterior nasal spine there. Okay, there you go, and then I can use my short PDO thread. So the length of like columella PDO threads, there is this 30 millimeter. They also have like 40 millimeter. So for urine, I'll be using the 30 millimeter. So if you have patients with short columella, choose the right length of your PDO thread. Now I do a twitching just to overcome any resistance, okay, and be gentle also. We know this area is sensitive. Then my last one will be this short columella PDO thread. Okay, so this is the final one. You're good, Joreen? Okay, so we have done this so-called repeat HICO treatment for Joreen. We'll show the result when CSA Medical Aesthetics returns. And we're back. So let's show the result to Joreen. Joreen, I'm gonna share the mirror.
I'm looking for it.
And look at the nose
wow.
projection and also the tip columella projection. Okay. So Joreen, you still have the lidocaine solution inside the bridge as well as here at the base of the columella. So it's normal that you still have some kind of engorgement there. Okay. But in a little while, it's gonna subside. It's still gonna soften. It may look sharp right now, but because I injected the so-called tumescent solution, it's a bit kind of still engorged, okay? But so far so good. I'm looking at the nose profile, okay? I want the angle already, the frontonasal angle. For me, it's a lot better. Plus the tip projection. If you look at the side view here, if you draw a straight or a vertical line like that, so the tip columella projection is a lot better, okay? Now at the base of the columella, you'll just notice parang engorge a little bit because that there's a lidocaine there, okay? So later on, it's gonna go away. Okay. So how was it, Joreen? How was the experience right now for your repeat treatment?
Yeah, so I can only speak for the user experience point of view. The only discomfort you would feel is the entry point of the anesthesia.
Yeah.
Other than that, it should be pain-free.
Yeah, exactly. So I know the feeling when we're injecting the tip with the lidocaine, like a 0.1 ml of that, because lidocaine is acidic. So when you feel it inside, it's kind of stingy or burning, okay? But that's just it. And after that, you're good, okay? So the technique I've shared, like it will help also in the reinsertion of those PDO threads. So when you already created that space, whereby actually you did like a hydro dissection, so you have a tunnel there, a space for the placement of your PDO threads, it's gonna be like a smooth insertion or a smooth glide there, okay? But for others, if it's really so fibrotic, okay, so you do some like twisting of your cannula there, you gradually insert it so you can still push the PDO threads, okay? And others were asking like, until when are you gonna do the repeat treatment? Like, once we have achieved already the, like, you know, the ideal height there, the ideal length, the ideal color width, and then it's already balanced and harmonious to the face, it looks natural, then actually we don't need repeat anymore. For cases like they've done this 3 times, 5 times, then we have achieved already the desired outcome, and you had this connective tissue buildup, and that will be okay already. For those individuals who are really into non-surgical treatments, okay, because there are people who decide to, like, I want the surgical one, I want to alter the shape, the, you know, the appearance of my nose. But for us, like us, we are just wanting to maintain what we have, or just enhance, or we call it tweakments, okay, not totally alter the anatomy. So we're into this non-surgical approach. Joreen, why non-surgical for you?
I think it's the idea of having a foreign substance in my nose area is a little too drastic for me. I like the simplicity of this, and I also like how you can carry on with your daily life, your daily routine the day after. You don't need a recovery period, and if so, it's really just resting it for a few hours, and that's
correct,
it.
yeah. So for people who are not into a long downtime and still want to maintain the natural outcome of it, and who are still afraid of the knife, okay, so this is the solution for you. Okay, thank you so much, Joreen.
Thank you so much.
Yeah.
Very
We'll see more of
talented.
you. Okay.
Thank you.
Yeah. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other episodes. I think Joreen has three episodes. Just go to our YouTube channel, Contessa Salvador. Joreen, do you have any social media that they could follow you?
Yes, you can follow me at Joreen Bautista on Instagram and Joreen B on TikTok.
There you go. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.